deadly was it? New, apparently more transmissible strains sequenced at the end of 2020 were worrisome, but some aspects of the pandemic could now slowly be discerned. How had nations dealt with it as a public health emergency? Had some been more adept and more successful? Of course, subsequent waves and virus mutations may alter any judgments that can be leveled now. But, barring miscalculations and surprises, we can draw some tentative conclusions. First, what we know about the virus medically has had surprisingly little influence on how nations decided to tackle the pandemic as a public health threat. The virus was rapidly identified and tests for it developed. That it spread primarily via respiratory droplets between humans, expelled as they coughed, sneezed, or breathed, quickly became apparent. Later, a more general aerosol transmission was identified as critical. Evident, too, and bad news, was its 2-week incubation period, allowing it to spread undetected. Though crucial, it was less clear whether victims were infectious even before they developed, or without having had, symptoms. Still, there was sufficient information to plan the public health counterattack. In the absence of a cure, vaccine, or other medical intervention, all the authorities could throw into the battle were the venerable contagious disease management techniques used against pandemics since biblical times. These amounted to interrupting chains of transmission by identifying the sick and potentially infected and isolating or otherwise rendering them harmless. Mercifully, the coronavirus seemed not to survive long outside its human hosts. That allowed objects, surfaces, and our everyday environment to be sterilized with fairly perfunctory disinfection using alcohol or soap. The principle of breaking chains of transmission was simple, but not the practicalities of implementing it. Though the science of the disease was clear, what preventive measures followed on that was not. Most of the many and various tactics chosen had defensible scientific backing. Quite different preventive conclusions could legitimately flow from the same understanding of the disease. Politicians thus had a palette of preventive possibilities to choose from. While informed by science, their choices were far from determined by it. Relations between politicians and the experts advising them were complicated. Those who spurned and mocked the scientific advice fared poorly. Presidents Donald Trump in the U.S. and Jair Bolsonaro in Brazil presided over chaotic, almost deliberately inept responses. Even Boris Johnson, another blustering populist, though less malevolent, paid a price for switching expert horses in midstream, flipping from a policy of moderate restriction to full-scale lockdown as the pandemic swept across the UK. Other leaders who followed what they understood as the scientific advice often did better, but not invariably. Whether it made sense to follow the experts depended on what they were counseling. Scientific advisors across the world delivered a far from unanimous message, pointing in many directions. Sweden is a country we follow in detail because the unexpectedness of its response brought it to international attention. Its experts delivered unorthodox recommendations, advising the country's leaders to strike out on an uncharted course of only moderate clampdown against the epidemic. But when it came time to pay the political price, as Sweden's mortality rates rocketed past those of its Nordic peers, it was naturally the politicians who were called to account. At that point, at the latest, it must have occurred to them that experts advise, but ultimately politicians decide.